Do you feel like you're doing enough to preserve your health, both now and for the future? In my profession, you have to be in peak condition. There's so much information available now that there are no excuses for us to not take a personal responsibility for our health. I'm Jon Cornish, CFL player, 2013 Canadian Athlete of the Year. When we're talking about being in peak condition, we normally just think of cardiovascular, physical, and mental health. These are the basic things I focus on when training to be my best on the field and in the weight room. Although it is very important to focus on these things, there are other areas of men's health that aren't frequently talked about that specifically concern our gender. Hey, I'm a man, and sooner or later I'm going to have to deal with the man problems. Do you know things like erectile dysfunction, waking up in the middle of the night, or more frequent trips to the bathroom can be related to prostate issues? We normally associate prostate difficulties with older men. However, 50% of men by the age of 50 already have prostate issues. Hold up, that seems like a lot of men. The reality is almost all men have an issue with their prostate at some point in their lives. With that said, why is this such a difficult topic to talk about? Avoiding the discussion doesn't make the problem go away. In fact, if you put it off long enough, it puts you at risk for an undesirable diagnosis. Our prostates can have three major conditions: prostatitis, benign prostate hyperplasia, and prostate cancer. There are two ways to diagnose these problems. The prostate-specific antigen, or PSA test, is the most common, but unfortunately, there are many variables that can affect the results of this test. Even having sex the night before can skew the results. The more accurate measure is the digital rectal exam, which requires a physical exam by a doctor. Guys, let's not avoid this conversation. No man wants to have one of these exams, but should we? Absolutely. There are definitely things we can do to be proactive with regard to our prostate. Staying active, a heart-healthy diet rich in leafy greens, and staying hydrated are all easy ways to ensure our prostate is in shape. Foods rich in selenium, zinc, lycopene, and EGCG are all commonly associated with prostate health. We can get these from Brazil nuts, pumpkin seeds, tomatoes, and green tea. But realistically, are we going to be able to eat enough to make a difference? In the case of lycopene, you would have to eat 3 cups of cooked tomatoes to get enough to make a difference. AOR's Advanced Prostate Relief has these protective nutrients in clinically effective doses, as well as sulforaphane, a detoxing compound found in broccoli. This formula is like a multivitamin for your prostate. It's an all-in-one specifically designed for your prostate. This is a proactive approach to reduce your risk of having to deal with the man problems. But if you do have the man problems, AOR has an excellent formula to help you deal with the symptoms of an enlarged prostate. Prostafil 2 is the most effective, clinically proven compound at reducing prostate symptoms, like frequent and intermittent urination and urinary discomfort. There are medications that can be prescribed by your doctor for these issues, but they can cause some unfortunate side effects. So gentlemen, let's be proactive instead of reactive and reduce the risk of prostate issues in our lives. So live well and take care.